phase 2, to transition from the floor to the bed, I'd like to introduce Shane, who's the head physio in the clinic, and he's also the head mentorship coach in the mentorship that supports me in coaching therapists. And what we're going to cover now is we're going to get the patient and have the confidence and clarity to say, right, you're ready to get to standing and do these standing progressions. Because far too many times I see therapists make the mistake where they don't really know if the patient's ready to go to standing exercises. They get them to standing exercises, and then notoriously what I see is that the motor adaptations kicks in and they do all these funky things, which I'll show you in the next lessons, to ultimately stop loading the areas that we want to get load in. So this exercise I'm going to show you, it's a quick and dirty test that ultimately is going to put excessive load through the soleus, the hamstrings, to make sure that the nervous system is happy to tolerate load through them. And then ultimately that's going to give us the confidence to say, well, okay, you've tolerated load with this test that I'm going to show you. So the standing exercises, they're actually a lot less load required in order to be successful. So we take the emotion out of it and we've earned the right to progress. And that's where this hump is going to come in. So just to remind you, you've restored your ability to challenge the base of support in 3 dimensions. You've restored ribcage mobility through either breathing exercises or hands-on or a combination. And now we're ready to go, right, the patient can tolerate load at submaximal levels. They're now ready to stand. So in order to prove that, we're going to do this test. So Shane, I'm just going to get you to lie on your back. And this test here, it's what I call a Soleus and Hamstring load tolerance test. So it's a modified bridge test, but ultimately what we're doing is we're just going to stress the soleus and we're going to stress the hamstrings and see what kind of reaction we get from the nervous system. So the first thing we'll do here is we're going to see where Shane can get to without his ankle becoming a limitation. So as I said, this test is probably not going to make the top literature or the top journals, but it's a quick and dirty test that's very useful for me in the real world with real people. Okay, so again, take it with a pinch of salt. There is limitations to this test, but the clarity that I get from this test in the real world, it's actually very, very useful. So what we want to do with Shane is we want to establish the point where he can lift his heel off the floor. Okay, so there's no point having Shane here and he can't lift his heel off the floor, because we're going to want to get weight onto his midfoot. So find that point where he can just lift his heel off the floor. So we know he can do it here. So if he doesn't want to do it here, then it's probably his nervous system choosing not to do so. So again, we don't want to have him too far where just structurally he can't do it. Okay. So what we're going to do now is we're going to straighten this leg. And all I'm going to get Shane to do is I'm going to get him to push through the midfoot gently and just bridge a little bit off the floor, just enough so I can get my hand under here. Okay. Now lift this leg off. And then the last bit of the test is, Shane, I want you to get your weight off your heel, push onto the midfoot, lift the heel off slightly, and don't let this bum come up. So drop the bum a little bit. Good. Now, where do you feel that working?
Feel my calf and a bit of hamstring.
Good. Okay. And there's no cramping?
No cramping.
Good. And you should start to feel his glute kick in a second. Can you feel your bum working? Perfect. And then come back down again. Good. So you'll usually feel the glute a little bit after this. Okay. So what we've done here with this test is we've put Shane in a position where he's got no choice but to put load through his soleus, his hamstring, by plantar flexing, and then lifting his bum a little bit. If we lifted Shane's bum a lot, so Shane, if you do a full bridge, his back is getting involved. So he's going to get a lot more low back here, a lot less lower limb. So the lower we keep his bum to the floor, not touching the floor, but as close to the floor as possible, the more load the lower limb is going to take, the less the back's going to get involved. Okay, so that's the first thing. Second thing, we want the weight off the heel because we want a plantar flex. We want soleus to have good intent. We want the distal hamstrings to also contract with the gastro. Okay, so what we're looking for here is exactly what happened with Shane. Okay, Shane can feel these muscles working, okay, but there's no cramping. And what you're usually going to find with patients who aren't ready to tolerate load through the whole limb is they'll either feel cramping in the calf muscle, they'll feel cramping in the hamstring, or usually they might even feel cramping in the foot. Now, cramping to me is, again, that's a sign that the nervous system is perceiving a threat and it's ultimately displaying an action that's resulting in a change of behavior. So when the muscle cramps, what do? We stop loading it. Okay, so the cramping to me is a protective mechanism set in as opposed to just muscle cramping. Okay, so I would see that muscle cramping as a perceived threat. So if Shane done this test and he cramped in his soleus, then I may consider, okay, why is that soleus doing all the work? Is it a case that there's a perceived threat in the soleus, or is it a case that he's not using this hamstring enough? Okay, and again, the answer to that is going to lie in the injury history. So you may need to go and assess these again. Use either the mentorship assessments if you're on a mentorship, or use your own assessments to investigate further before you allow the patient to progress. So again, is he loading his hamstring? Is there a perceived threat here where when he pushes down, his nervous system doesn't want to take load through the hamstring, maybe due to a previous injury, strain or tear. Maybe his pelvic floor doesn't want to take load. So then soleus may be doing it all. Or is he cramping through the foot because the soleus doesn't want to take load? So again, there's the interpretation. There has to be the clinical reasoning, which is really going to be modules 1 and 2 in the mentorship for us, where it's like, let's look at the subjective assessment, understand the story, and then make sense of the objective assessment. Or for you, you have to be able to use your own assessments to dive deeper into why this is happening. And as I said, what you don't want to do is just give a blanket statement, oh, it's because of weak glutes or it's because of this. Make it specific to the patient's story, okay? So as I said, this test, it's a useful test. There's going to be a lot of load going through the soleus and the hamstrings, but ultimately it's going to give us the confidence now that if Shane can tolerate this load, then when we get him standing again, then he's not going to actually have to tolerate half as much load through his soleus and hamstring as he's just done now.